Sure. Testing. Testing 1, 2.
Testing.
Call the meeting to order and start with the Pledge of Allegiance. Roll call, please.
Savers. Here. Rice.
Here.
Dosher. McCardle.
Here.
Barrington.
Here.
Allen.
Here.
Chark. Here. Smith.
Here. Okay, we have a quorum. I will point out that people can be in the Corn Palace, and if they want to come over and speak to this, they'll be allowed to do so one at a time. We're also monitoring the city websites or Facebook and YouTube and all the places you can make comments and emails. So if you have a comment you want read, you can go about it that way. Okay, we're here for the first reading on Ordinance 020-2006, continuing addressing a public health crisis by implementing and modifying certain measures which have been deemed necessary to slow the community spread of coronavirus COVID-19. As we get started here, I'll give you a couple of the latest statistics. Davidson County is still sitting at 5 cases. 4 have been recovered or have recovered. One of those, that there was a city employee who was tested positive. That person has recovered and has been approved by the Department of Health to go back to work. Aurora County is at 1 and 1 recovered. Sanborn is at 3 and 3 recovered. Miners has 1 case. They have not recovered. Hanson has no cases. McCook has 4, 1 recovered, 1 deceased. You'll have to remember, if they pass away, they do not show up in the recovered. So technically all 4 of them are finished with the disease in McCook. Hutchinson has 3 cases, 2 have recovered. Gerald has 6 cases, 4 recovered, 1 deceased. Beadle County has 21 cases, 19 recovered, 2 deceased. Charles Mix, 4 cases, 4 recovered. Brule, no cases. Douglas County has 1, no recovers. And Lyman County has 2 recovered. So we are seeing a lot of, we're not seeing a big spread of it. I don't believe we've been called community spread yet either, have we, here in Davidson County? So.
And I think it's good news that there are only 33 new cases today statewide.
Yes.
That's a positive trend.
Yes. So that's kind of where we stand with this right now. As you know, we've been getting I've been getting some emails today about opening up. Most are in support. There were a couple that desired to have us keep it closed or do a very slow start. The biggest, not complaint, but argument with what our ordinance has is the wearing of masks. People are not thrilled about the part having to wear masks. Did a little more research into that. Of course, what we're doing is modeling ours after, and Mr. Johnson can speak to this here in just a minute, but we're modeling ours after the CDC, Department of Health, and the state executive order signed by Governor Noem. In the CDC's guidelines, they recommend masks. However, there is a lot of differences in which section of the CDC you pick. If you look at, there's a spot for groups, that says one thing about masks. Businesses says another thing about masks. So there's a little bit of ambiguity in there, or non-consistency. Governor Noem has, in her executive order, some wording and whatnot, which we're trying to incorporate into this. So I know there will probably be a lot of comments regarding what we have written. It is a lengthy ordinance. It is a bit complicated, admittedly, but we are kind of in a complicated time. So, Mr. Johnson, with that, you want to take over?
Sure. I'll start off just by kind of reminding people where we are with the ordinance that's currently in place. I'm sure it's not going to be a surprise to anybody, but the last ordinance focused more on closure of certain types of businesses that tended to accumulate crowds. Notably, that'd be restaurants, food courts, bars, things like that. We're limited to providing takeout, delivery, alternative forms of service so that there was not on-site consumption. Similarly, recreational facilities, theaters were subject to the closure, as were things like bowling alleys, casinos. The list, I guess, intended to strike a balance between places that may have been less essential to everyday life, although we didn't make a distinction on essential versus non-essential, but it did also exempt a certain number of business types, such as healthcare facilities, crisis shelters, and things like that. If you compare that to the ordinance that you have in front of you tonight, the big difference, obviously, is that we're not making any distinguishment between different types of facilities. So it doesn't matter if you're a bar, a restaurant, doesn't matter if you're a gym or a nursing home. Really, you're going to be subject to the same guidelines, and that's really comes back to what the CDC has in place as far as their hygiene guidelines. So on the individual level, everybody's going to be responsible for following those CDC health guidelines. Those include things like washing your hands often, using sanitizer when that's not available. Yeah, we're getting there, Doug. Avoiding touching your eyes, avoiding close contact with those that are sick, staying at home when you can, keeping a minimum of 6 feet separation between yourself and others, covering your mouth and nose with a cloth face cover when you're around others, especially when in public, and cleaning frequently touched surfaces daily. There is also a restriction on unnecessary gatherings of 10 or more, and again, that fairly closely tracks the language in Governor Noem's Executive Order 2020-12. We do also have some specific sections in here as to what businesses can do to help individuals follow these health CDC hygiene guidelines, and ways that they can do that so that people are put in a good position to be able to follow those guidelines. We do also have language in there for employee screening programs at businesses. We do also have language in there that discusses a couple of limitations and exceptions on those general CDC guidelines. Seen in a number of different places where they exempt people from having to maintain that 6 feet separation when you're talking about people who are in the same immediate family and people who are in the same household. In addition,
Do you want to have us ask questions as you go, or do you want to go through the whole thing and then have us come back?
either way, if you got questions, we
Do you
can
have a
take those.
preference
Otherwise,
Of how we do that?
we're getting pretty close to the end here too. So
Okay.
So there's another exception in here as to necessary close contact where you've got certain business operations where people are required to be within close proximity of each other. And we're just recommending use of face masks in those situations. There are a number of facilities that we still exempt from the ordinance, but we do also recommend that they follow those health guidelines to the extent possible. And then as far as the penalties and enforcement mechanisms, it's pretty much the same as the last ordinance, except we do add in some nuisance language so that the city has some additional options to address violations that need an immediate remedy. So I think with that, we can probably move over to questions from the council.
One thing I want to point out quickly is that Governor Nome in our conference call today said she is going to be issuing a new executive order. She expects that to be done tomorrow and signed tomorrow. We don't know. She gave no idea what's in it, but it will change a little bit what's in the current executive order from what's in the current executive order. So that will be coming tomorrow or Wednesday.
That's correct, and I guess based off of the changes that she makes, obviously that could have a huge impact on what's in this ordinance too. I wouldn't think that she'd be suggesting anything other than following the CDC guidelines, but it's possible that she may roll back some of the conditions that she had in that last executive order.
And as far as city facilities go, right now our intent is to remain with the JVCC and library closed. Since we are allowing other gymnasiums, if you will, or fitness centers, I did have people call me asking that the rec center be open for the elderly to use in their exercise routines or, for their fitness. So we would look at bringing that online for adults only. It would not be a 24/7 issue because you need to have the ability to clean it, so somebody would have to be there. So we would do it on limited hours. We've not worked out all the details on that yet. I would expect we would have to have something, the thing that comes to mind is something like the golf course does with tee times. I don't know if that would work for this, but some way that we can monitor how many are actually in the rec center at any one time. They do have aqua fitness, is that what they're called? Classes. Those are rather large classes. What the rec center is proposing is those be downsized. So they are seniors that attend those, so that they would be groups of like 10, and then they would put, 2 to 3 times the amount of classes that they normally have. So just so you know what we're thinking citywide. Okay.
Justin, could you address the timing of the enactment of this thing?
Yeah, so if we proceed with the first reading tonight, and assuming that there aren't any major changes, but even if there are, that should put us on track for a second reading a week from today on May 4th. And after that, the ordinance can be effective upon publication. The Daily Republic's down to publishing physical paper twice a week. With us holding the meeting on May 4th, it's unlikely that we would have that published on May 6th, although we'll have most likely it would end up being published on May 9th and go into effect at that time.
That'd be Saturday.
Correct.
We're kind of at the mercy of the paper and a little bit.
We should not be at the mercy of the paper.
I agree, but it has to be published, and that's our official paper, so.
If they want to do it
We-
for a Wednesday, could they,
We can try to get it in Wednesday.
could they
but
have a spot for a yes and a no? I mean,
I guess we have to ask, we'd have to check on that.
Yeah, I suggested, oh, that's different, so. So we'll check more into whether that's going to be an option or not, once we know more towards what the final version of the ordinance would end up being. So if there's going to be changes that come out of tonight, then we might have to wait until we get further in the process. But if we know what the final version is going to look like, then they should be able to know how much space we'll need. And I guess there would still potentially be some risk if the council doesn't end up adopting that version. But if we're pretty set in the way, then we should be able to work something out with them, I would think, to get something published next Wednesday.
If we can do it Wednesday, we'll do it Wednesday.
And how much time between first reading and second reading is required?
There has to be at least 5 days.
So we could, if you wanted a special meeting, you could do it Saturday, right?
And it still wouldn't be open until Wednesday.
Still wouldn't open, correct. So the earliest you could realistically get this done would be Wednesday. The latest, if it's all approved, would be a week from Saturday.
The 6th or the 9th.
Yes.
And if we wait till next Monday, the earliest would be Saturday
No, we might be able to do it. We're going to see if we can get it Wednesday.
in the paper.
Right. The key there is you got to approve it. And they've got to be able to put an ad together for us or have the space for an ad for us. Because I think they put their Wednesday paper together Friday.
Yeah, if you're following their normal timeline, we'd have to have something to them by this Friday for it to be published next Wednesday. And I believe we'd have to have it to them by next Wednesday to have something published next Saturday.
There may be an option to purchase a special ad that would allow us to do it Wednesday, either way. But is it? Oh, okay, all right. Then it might be Saturday at the earliest.
So when, if we pass this, when do all the guidelines have to be set? By tonight? First reading?
No, we can make adjustments tonight.
Tonight is adjustment.
Yep, tonight's adjustments. Second reading, it has to be set for the way it's going to go.
I mean, I see.
Correct, Mr. Johnson?
Right.
I mean, I'm all in for the first reading, because that way, if we want to move forward, we can. What's right or wrong, what's adjustments? I've gotten more phone calls on this than anything since I've been on here. Maybe it's my line of people, and everybody that's on my line of work, they got my cell number, I think. But
I gave your number out.
And most of them have been nice conversations, and I've had more of leaving it the way it is than in favor. Now, that don't mean nothing. That means the 20 people that called me, out of that, there was a majority. But I'm all in favor of getting the first reading done, and that's going to give us a week to see where our numbers are. I'm worried about. I want to see bars open. I know we need spacings. The health. Everybody's got a capacity, so you can, if like our capacity is 155 people. So if we do a percentage of that, like if we do 25%, 40%, whatever you think is fair. I'm dead against the 10 people, because 10 people in a big, huge venue, that's not worth being open.
Well, right now you can have more than 10 people, but once you do that, that's where the mask thing comes into play. So, and that's what most people have at least have contacted me dislike, is the mask portion of it.
I don't blame
I don't blame them. I don't like it either. But,
It's hard to eat spaghetti.
I don't really want to get coronavirus either. So.
No. And, we've been closed up out there for probably a month, so everything's safe. I go to work, it's safe. Now we're starting to bring people back in to start doing work tomorrow, so now we got to worry about that aspect. And that's scary, and I understand it. But as far as getting back to normal, when is normal? I had a person tell me there's no way we're going to have football this fall. That's just an opinion. I don't know how you know, but to me, the first reading is a no-brainer to get it to where we need to be, because that don't mean it's going into effect, and then we can do the second. And that's just my opinion. So I'll be voting for the first approval of the first reading.
Justin, a quick question. If they have over 10 people, does that mean they have to have a mask on? Is that what you're saying? Is that what you said, if it's over 10?
That's the way it's written currently, right?
Yeah, so if you're gonna be, having a necessary gathering of 10 or more people, then you'd want to, distance those people, and I guess, what we mean by that is, have 6 feet or more between individuals or groups that you can consider.
The
to be
customers don't need to have
individuals.
a mask on, do they?
Yes.
Do they?
Yes,
Yes.
yes, so it would be each individual.
And are you talking all stores, customers?
Yes,
Yes.
The ones that are open now?
yes.
I have a question on, and we keep using the term masks. Are we talking face coverings or are we talking masks? Nathan has a face covering on, but he does not have a mask on.
They're talking, the CDC, as I understand, that talks about cloth mask, or cloth face covers.
CDC recommendation is for cloth face coverings that cover both the mouth and nose.
So it's not masks.
Tough to eat that way.
Correct.
You take it off and eat, yes.
I see a problem with that, requiring masks, face coverings, call it what you want. I'm sitting there having dinner, don't have a mask, but there's only 7 people. Next thing I know, there's 20, spaced out nicely. Who's got to go? This mask deal is going to be a real problem to enforce. I think you make it highly recommended, but
Not mandatory.
enforce it is going to be real difficult.
The terminology that I have seen, and Bob, I agree, the CDC, when you read one section, you see one and the other, but the guidelines that were sent out, and we put it in as part of our documents that we have in here, the term is strongly suggest. So I'm not in favor of mandatory face coverings either, or masks, but I would not be opposed to strongly suggest,
Okay.
which doesn't make it mandatory. That would be my recommendation.
Yeah, I agree with that. I just don't know how you say that people in a restaurant or in a bar or at the movie are required to wear a mask. I just don't think logistically that that's a feasible requirement, but a strongly suggest, I think, is appropriate.
And where I stand at from people that I've heard from, I would have a hard time supporting any kind of ordinance that requires a mask of any sort. I won't support it.
I agree with Jeff on that, too.
We got the President of the United States, and he said he wasn't never going to wear a mask.
What does that mean?
Yeah, I asked him.
I'm trying to figure out where that goes in here.
That was a number 3.
Number
Okay, that's what,
3 and 4, wasn't it?
Yeah,
the
the
participants.
face mask is kind of built into each section, so that's gonna be a pretty
Okay.
substantial rewrite. But, I mean, if that's council's direction, that's not a problem, I can make that happen.
Okay.
Because section 4A requires that, says 2G has to be a requirement, and it's not a requirement, it's suggested.
Strongly.
And I can see how we may want to say something like in a business where people are in constant close proximity to each other, that a mask would be required if it's, I don't know, I feel like if you're in a manufacturing plant and you're close to each other, that may be something that the owners of those businesses may want to include as part of their requirements.
There again, though, you're running into an enforcement, wouldn't you?
Well, you can still, yeah, I mean.
If we strongly suggested it, well, I don't know.
It's optional.
Yeah.
I talked to the Trail King employees or some of the management there, and there's about half of them, I believe, or maybe 30% of them do wear a face
Okay.
covering.
You know, I asked
It's their
Brian
option.
today before I came, I said, so really, we're just protecting ourselves with the mask? And he said, no, you're not. You're protecting people around you, too. So,
Correct, yeah.
so
Well,
I
that's
think
interesting.
that's something that I think we assume, I'm wearing this to protect myself.
No,
That's
you're
not the
protecting other
Exactly,
people
yeah.
from you, technically.
Exactly.
Is
So
what
I
you're
think,
doing.
I think that's an important thing for people to understand when we talk about that.
So Justin, obviously for us to go ahead and modify this ordinance, do we want to keep having discussions, or do we want to take a look at having things itemized out? Like, for example, we were clearly talking about just masks right now. Obviously, I believe there's other things in the ordinance we want to discuss, but from what I'm sort of getting a feel for here, that I believe that the council probably is in favor of not having the mask be required, or strongly suggest should be changed. Should we go ahead and make a motion on that one piece, or how would you like to do this to make changes to this ordinance?
It'd probably be easier to track if we're doing that one at a time. So if there's a motion to amend it to no longer make face masks or face coverings required, and to strongly suggest their use in those situations, we could have that motion, and then we can move on to the next topic.
And with that being said, I will make that motion that I'd like to have that change. That'll be strongly suggest, not mandatory.
Okay, motion by
I'll
Mr.
second.
Barrington, second by Mr. McCardle. One question though, do you want where Mrs. Charks talked about requiring them?
Well, I think it's going to vary. I guess the strongly suggest is, I mean, I don't know how we can mandate that because every business is different. I mean,
Okay.
you've got some businesses that have independent offices, and I'm thinking primarily of manufacturing companies or places where people are in daily close proximity to each other. But I don't know that, I think you're right. I think it's hard to mandate.
I think strongly suggest covers it all.
Correct. I mean, that is our recommendation to, all the places throughout the city, and I think it's up to those businesses to make their own decision. Where I work at Custom Touch Homes, we're not forcing anybody to do it, but there's plenty of them out back that are working that are wearing masks because that's their choice, and that's, what we need to do. And I think these businesses here in town, too, from Trail King to the box factory, let them dictate what they want to do for their employees. I don't think we're in that position to do that.
And understanding that if we see a sudden rise in cases, then we're going to have to go back. So I think that it would be in everybody's best behalf to do what they can to prevent the spread. So if that means that we're requiring masks at different places, then so be it.
Okay.
And keep in mind, it was presented this way in the ordinance because it is one of the CDC recommendations, and Governor Noem's current executive order 2020-12 says that every South Dakotan shall follow those. So, we're not implementing anything new. We're piggybacking off of what she had said. Everybody was already supposed to have been doing that. Obviously, the state's not really been enforcing that and probably has no ability to do so, but that's why it was presented the way that it was.
Okay, Justin, then to me, that brings the question, and I'm going to address section 4A, that the governor's statement that that's the responsibility of all the people in the state to do that. But section 4A, then we put that responsibility on the businesses to do that. Why are we putting that responsibility on the businesses when that responsibility is and should be on the people of the state? Because how is a business going to know if I washed my hands thoroughly with soap for 20 seconds? And how are they going to know if I clean surfaces? Or how are they going to know if I touched my face or eyes? And we're specifically stating that a business that remains open must ensure that all visitors and patrons do those things.
Yeah.
How can you answer the question, how is a business going to know that?
I guess observation while they're there, but really it comes back to the language of the executive order.
And that's what it says, that is what it says in the executive order. Businesses shall suspend or modify business practices that follow CDC guidance, involve 10 or more people. I mean, that's what she wrote, so.
Right, but it doesn't state that the business needs to check that somebody washed their hands.
If they're saying business shall, they've got to do it. So really, what we've done is written it basically the same way the governor has, but we can modify that. That's why we're here. So.
I don't agree with your interpretation of that.
Well, therein lies, a lot of the interpretations are not the same with individuals, so.
Yeah, I mean, the language specifically, Steve, says all employers, both profit and not-for-profit within the state of South Dakota shall implement the recommended CDC hygiene practices and other business strategies designed to reduce the likelihood of spreading the disease.
Right, and that doesn't say anything to the people that visit those businesses. that says if I have a business, I have to do that. It doesn't say the patrons that visit the business have to do that, or that the business has to ensure that the patrons that visit there have to do that.
But we can say that those things need to be available at every business,
For sure.
for sure.
No problem with that. But
With maybe recommendations.
Recommendations.
Wash your hands for 20 minutes, please, or 20 seconds. 20 minutes would be even better. Use hand sanitizer, you know, et cetera.
Which is one of the points that's made, is hand sanitizer is going to be made available, but,
We're getting off track. We're doing one condition at a time.
oh, yeah, you're right.
The condition we're talking about are masks. Now we're going to something else.
You're right.
I thought we were going to
Thank you
handle
for
one
bringing
at
us
a time.
back. One at a time. Any further discussion on the mask? Are there any comments from outside?
Is there many people out there?
I have gotten one online comment, and I have asked for everyone to state their full name if they want to comment on something in here. And this came from Jim Foster. Hold on, I got to scroll back up. He says it should be determined by your square footage, not just 10 people.
We're
Yeah.
talking masks, right?
Came up during the mask discussion when you were saying 10 or more have to wear a mask.
Is there anybody out there who wants to speak? Just on the masks, if they got a comment on the masks.
It's a little hard to hear out there.
Okay.
I will go let them know that. Good luck.
He's the middleman.
And then the only other real comments were several people saying it would be very difficult in a restaurant to have a mask on while you're out to eat. And then there was a question on if you have a family that's all related of 6 people, could all 6 sit together
Yeah.
at one table?
That is, yeah, we allow that without the 6-foot separation. Presumably, they're all coming in one car anyway. No, we're not having.
I suppose one other thing I could say in there is that when we were requiring those face masks, which if we vote to strongly suggest won't make a difference here, but it was that they wear those when feasible.
Come on up.
I'm Kevin Carroll, pastor of Grace Reformed Church. Mr. Mayor, honorable members of City Council, let me begin by saying that Grace Reformed Church appreciates this council, and we pray for you often in our public worship services. I'm addressing the council on behalf of the church. Though churches have not yet been the subject of any ordinances in Mitchell so far, we understand that it is the opinion of some that the proposed ordinance includes churches despite the fact that we are not in any way retail businesses. We wanted to inform you that we have nevertheless voluntarily done the following for the last month. We set up a live stream so that those with health concerns could continue to participate in public worship to an extent. We've instructed those who are elderly or have underlying health concerns to stay at home. We've instructed those who are symptomatic or have been exposed to someone who is to stay at home. We required everyone who attends public worship to use provided hand sanitizer upon entering the building, though it's challenging finding it at times. Required everyone who attends to refrain from shaking hands, embracing, etc. Required family units to sit at least 6 feet from other family units and to maintain that distance before and after services. Required everyone who attends to keep visiting after services to a minimum and to return home as quickly as possible. Additionally, we have discontinued observance of the Lord's Supper and have stopped passing offering plates. In short, we believe that we have voluntarily taken precautions to prevent the spread of COVID-19 in our community. We also believe, however, that the ordinance as it is currently worded is both unnecessary and an overreach by the city. Furthermore, we believe that the proposed ordinance will place an undue burden on churches exercising their First Amendment rights. We would respectfully ask then that the council either amend the ordinance by striking the language requiring masks or by adding language exempting churches. Thank you.
Jason Bates, Big Dummies. Happy that we're moving forward finally. Masks will be very hard for, bars, restaurants, people to eat. I know that my bartenders and we cook, going in and out of a hot kitchen. And the whole idea is they want you to wash your hands. And I know in my bar, we wash our hands constantly, probably more than just about any business that I could tell you. I'm going to touch my face 10 times as much as if I have to constantly adjust a mask when I'm sweating, which, in a hot kitchen, that mask is probably going to be a breeding ground for bacteria and increase my chances of a respiratory infection. So when I read the 10 people or more, I actually emailed Justin because it was pretty unclear because everybody I talked to, they didn't understand. Was it only 10 people in the bar? Was it groups of 10 people? Was it? So as far as the masks and washing your hands and cleanliness, I mean, it's how do you know they washed their hands when they went to the bathroom? You just got to trust that people are taking this serious and taking care of themselves as far as hygiene and you're fine. As far as hygiene and trust that they're doing that. I wasn't gonna bring up this point, but Susan said something that made me think of this. I can find you dozens of doctors that say masks and social distancing and quarantine is unnecessary now. It was then because we didn't know what COVID-19 was. Now that we've had months to research it and find the numbers, it's something like 0.03% mortality rate, and 90% of the 0.03 are dying because they had pre-existing conditions. So lots of numbers, very small cases. So they're, and the point I'm making about the masks is and the cleanliness, and I'm going to do everything I can to keep the bar clean just because I always have. But when Susan said that if we see a rise in cases, then we're going to have to maybe go back to the masks. But what you got to understand is immunology 101. Your body needs bacteria and disease. Like when a baby's born, they have no immune system. That's why they're so fragile. Crawling around the floor and getting in contact with stuff is how their immune system builds. And the reason I'm bringing this up is because of what Susan said. When you quarantine healthy people, you break down their immune system because they're no longer being exposed to things like, disease and bacteria. And what happens is when you take the quarantine away, these people that have their immune systems broken down increase their chances of being sick tenfold. So you're going to see a spike in people getting sick. Not necessarily COVID-19, but by the social distancing and I'm willing to do whatever you guys want to do to just try to get the doors back on, but you need to realize that immunology 101, if you are constantly covering yourself with masks and not exposing yourself to just common bacterias, you're breaking down your immune system and increasing your chances of getting sick. So that's why I'm kind of against the masks, and you need to be exposed to things to get your immune system. So that's about all I got for that. But thank you.
Thank you.
Excuse me. I'm speaking in regards of people going back to work and opening up the public. I'm sorry, Reve Moline here in Mitchell. I completely disagree on opening it up. I feel it is way too early to start doing this. You have to realize South Dakota, North Dakota, and Iowa, all three of our states were one of the last three states to get this virus. And I feel that it is way too early. The governor said the peak time is in June. Now I think they're saying the end of May, which I think would be a good idea to wait. My concern is if people go back to work, get out in the public, more people are going to get sick. And is Mitchell, this little town of Mitchell, I know we're not that big, but we're not that little either. but are we ready to face an epidemic like Sioux Falls has gotten? And I feel if we go back to work and get out in the public too early, this is what's going to happen. People are going to get more sick, and the virus is going to spread. And the second question I have is, you have to realize as well that everyone is saying that there is another epidemic coming in the wintertime. And so as a city, as a state, we need to be prepared for that. Is Mitchell going to be ready for a second epidemic? And how is Mitchell set up to face something like Sioux Falls or Chicago? I know we're not that big, but do we have enough ventilators? Do we have enough test tubes? All of these things, I think Mitchell needs to realize that yes, we haven't gotten that many. Praise the Lord, we haven't. But what if it does reoccur once people start working? All it takes is just one person. Thank you.
Thank you.
I think it should be known that we are looking at and discussing conditions for reopening. It's not blanket reopening. We're talking masks first. There'll be other conditions upon reopening. Justin has started the deal, and
Yes, I will point out that in our meetings with Queen of Peace, we have flattened the curve. In fact, the governor has stated that numerous times. The curve has been flattened, so we have spread the disease out, the virus out, as desired. Does that mean we have enough ventilators? Nobody knows that. However, I will point out if you go on a ventilator, your chances of surviving the disease or the virus are not good. So we have flattened the curve, though. That is what we were trying to do. The numbers are the numbers. You know, the health professionals tell you if you're going to get this, you're going to get this. So really, testing-wise, the only people they're testing are those that are healthcare workers or that have a high probability of contracting the virus. If you're healthy and walk in and say, hey, I think I've got it, I want to be tested, they send you home, tell you to come back if you get worse. So, okay, we're talking about masks. Anything else on masks?
Call the question on masks.
Okay, all those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Strongly recommend masks. Correct? All right, next point.
Well,
Okay.
I'm still uncomfortable with and I don't have a change in section 4 that we're saying a business, if I walk into a business, they need to ensure that I have washed my hands or I do wash my hands for 20 seconds. Or that they must ensure that, what's one of the other ones? I avoid touching my eyes, nose, and mouth. I mean, we include 2A, B, D, 2F, G, and 3 in a business that remains open must ensure that all visitors and patrons do that. And I don't believe the governor's proclamation is intended to say that a business is going to make sure that everybody that goes in there is following those guides, is doing that.
How would you like to see it reworded, or do you want to see it removed?
I'd take it out of there.
isn't there a spot somewhere that businesses will provide sanitation or what's it?
Yeah, that's 4C.
4C talks about providing sanitizers, and the businesses would be encouraged to not only have it, they may be forced to have it.
Encourage would be a great word. Encourage would be a great word instead of ensure.
Can you even get all the sanitizers and everything for the front doors of any of these? A lot of this stuff it's still short supply.
You know, and the fact that it's every business.
That's right.
So if I walk into Innovative Systems that I need to have hand sanitizer,
You don't have hand sanitizer now?
Not sitting at the door when I walk in.
Oh.
No, no. Why would I? I don't have any public that comes in.
I carry my own with me everywhere. Okay.
Right,
No,
but-
so
but
how, I guess what we need to know is how we want to word it, or you want to remove the whole paragraph? You want to remove number 4? What do you want to do?
To me, the word ensure is bad, and I could put encourage
I like encourage.
I like
in
encourage.
place of that.
Okay.
Yeah, I guess just keep in mind that removes your ability to enforce that.
Well,
So-
I don't know.
I have that,
Nobody's
that's a
enforcing it
question
now
later
anyway.
on.
I don't know how you would enforce the ensuring that visitors and patrons do those things. I just don't know that that's an enforceable thing.
And nobody's enforcing it anyway right now, because you go to the grocery stores and there's Walmart, Menards, Colburn's, County Fair, nobody's enforcing any of that stuff.
And
I mean,
most of them have sanitizer
wipes.
for the carts, but
I mean, what I'm
presumably
getting
you
at
use that on
here is
your hands
if
as well, but
we're-
Menards does, Walmart does,
All the grocery stores.
Coburn's does. Yeah, pretty much all of them do, but
Nobody watches to make sure you do when you walk in the store, so
the point that I'm trying to make is if you're trying to make all of these things suggestions and not requiring people to do them, there's no reason to put them in ordinance.
Well, I think you can require it of your employees. I think that, there's signs in bathrooms in every place that says all employees must wash their hands prior to returning to work. You see that all the time. And I think it's that in B, businesses that remain open must ensure that all employees on the premises meet the provisions. But I think it's tough to ensure that all visitors, patrons, and other non-employee individuals meet those provisions. I just don't know how, unless you've got someone that's following them around, I don't know how you ensure that.
Right, and I guess that's where it goes. If you look under section E, obviously, we're not expecting people to tail individual customers or something like that around the store. But if they see a violation and they're aware of a violation, then they should make an attempt to address that violation. We're not saying that they have to be omniscient. We're not saying that they have to, take additional steps to be aware of these things, but if they see something, they should address it.
I'm fine with encourage. Because it still points out that even your visitors should be following CDC rules.
so you want ensure in B and encourage in A?
Yeah, I guess I'd just like to clarify that. Are we talking about just section 4A?
Yes.
From ensure to encourage?
Yes. I am. I don't know about Steve.
For right now, yes.
I mean, I can see them having the hand sanitizer sitting there and just a sign that says, please use the hand sanitizer prior to coming into the building, or whatever.
But again, we're talking every business, not just a grocery store or anything else. Every business.
That has people coming in. That has people coming in from outside.
That doesn't say that.
Is remains open a business that is by appointments
That
only?
all visitors, patrons, and other
So
non-employees.
if I go to the gas station, before I walk in, I gotta,
You're encouraged. Well, if you're going to do encourage,
Encourage, you don't have to, they just want you to.
If it's encouraged, I could see you walk into a gas station, the clerk says, there's a hand sanitizer there that you're welcome to use. You walk into a casino, the bartender, casino patron, person working there says, there's some sanitizer right there. We'd sure appreciate it if you use it. Whatever business you walk into Innovative Systems, and the receptionist says, there's some sanitizer right there. I think we'd sure appreciate it if you use it.
so really number C, you want to say, rather than must provide, should provide. Is that right? Because you're kind of getting on two different paragraphs.
There are several comments coming across the city's Facebook page saying that hand sanitizer is available now in the gallons. So it shouldn't be hard to get anymore, according to some.
Right. I told them at the beginning of the chat feed that for their comments to be read into the meeting, they have to state their full name at the beginning.
Read their name.
I'm well, because otherwise there's conversations happening on there that aren't always appropriate for council. So I've asked them throughout the chat feed to state their full name if they want their comment read into the meeting. Okay. I do that on YouTube as well. And now I have one.
I seen the gallon hand sanitizers at the grocery store on the west side of Mitchell, and it was $31 or $32 a gallon for over 70% alcohol in there.
And Mayor, maybe I should clarify too, before you were having council discussion and then opening it up, do you want me to save them all for the end, or should I be interjecting? Because I was waiting until you get to your.
And
That's
Yeah,
what
well,
I.
you're going to
okay.
have to bring them in.
Bring them in pertaining to what we're
Okay.
discussing, yeah.
This is not going to be an easy process.
It's not.
Yeah, if we're going to do it in sections and they have a comment on that section, they're going to have to come
Okay.
during that section.
I just don't want to be interrupting your conversation, so I've been kind of stepping back on these, so I don't want the online comments to think
We're
I'm
on
not
new
watching
territory,
those.
in
Yeah.
new territory here, folks, so we're kind of learning as we go, unfortunately. Okay? Okay, so you want to go with encourage in 4A?
In section 4A, yes, I'll make that motion.
Okay.
second,
Motion by Mr. Rice, second by Mr. Sabers. Further discussion? Is there, I almost hate to ask this, anybody, is there any comments relative to it?
Yes, would you like me to go through those now?
Yes.
Okay. I just want to make sure that I don't want people on here thinking we're ignoring their comments. That's my reason for my earlier comment. Going back through here. Christy Gunkel from Second and Lawler says it'd be impossible for her staff to verify every customer uses sanitizers. She would lose customers if she addresses them breaking the rules. Christy Gunkel, I've spent extra money to bring in 2 hand sanitizer stations. And I know for a fact that Jones Supply was running short a few weeks ago. They only had a limited supply. And then people are replying back that they have gallons available elsewhere.
Okay.
Let me get to YouTube here.
Is there anybody out there that wants to address hand sanitizer?
Doug, if there's anybody else that has comments in the Corn Palace that they wanted to come over to. Someone thanked all the council members for your time, and they appreciate it. It isn't easy. That comes from Sonia, Sonia Van Erdewick. The rest are talking to each other on YouTube.
Okay.
So what is Steve's motion?
His motion is to change ensure to encourage in 4A. Okay? Further discussion? All those in favor of the motion signify by saying aye.
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 Opposed, nay. Motion carried. Okay. Next item. Feel like I'm on the Price is Right.
2 down, 10 to go.
If we're going in order, I think B is probably fine because I believe that we should be able to control your employees. That is something that we, unless somebody's got an issue to that. And C, though, is must provide sanitize, a method for sanitizing, which I think most have, but again, is it a must?
May provide then.
I don't know.
I disagree. I think it should be a must.
Okay.
There's a table at the entry. I just don't understand what's the negative to having sanitizer, so it's there at any business. There's zero negative,
Yeah. So C's okay?
in my opinion.
Okay. Anybody else object? D?
I do have some issues with D.
Okay.
And right now, I don't see every business standing at the front door waiting for their employees to come in, but you do have the ability to train your employees and visit with your employees to make for sure to follow again the CDC rules is if you are feeling ill, please stay home. But to say it on a daily basis, to check every single person coming through and ask a series of questions and then take their temperature, again, I don't think it's feasible. And
We do it here in City Hall.
some are doing it.
I mean, it actually, we were doing that where the one city employee ended up with it, and it turned out to be a very big bonus for the Department of Health in their investigation. So, I don't know, it's up to you guys.
I think it's up to the business, they can monitor themselves, because you gotta have somebody waiting at it's just gonna be time consuming, if you ask me, for a lot of businesses, but I'd be in favor of not having must in there.
Keep in mind, most of Mitchell is open.
Right? And I know a lot of the manufacturing people claim they're doing this already.
And it's their prerogative, and we didn't force them to do it.
No, we strongly recommended it. We
Right.
did not.
And that's probably a good word for this.
I can see it on a place of work, but a place of retail,
It's only employees.
It's
not
employees.
customers.
okay, answers that.
I mean, there's a lot fewer, we tell them if they want to scan, they can, but we're not requiring it of customers, only employees. And typically retail, I don't know, I suppose if a bar's open, well, they're not going to have the biggest crowds anymore either. You're talking 2-3 people on a shift, probably.
Right. But are we going to assure that there's a minimum questions asked of, what is there, 8,000 employees or whatever there is in Mitchell, that on a single day?
We actually have a form for the questions, and they're yes and no, and it's very simple. You didn't look on the table out here when you came in, did you? John and I took our temperature.
Which I'm not saying is bad.
I mean, it's
But again, if whatever we put in print, we better be prepared
Yeah.
to enforce.
I'd say should.
Okay.
That's where I would be.
Right.
Should? Under D?
So there's a few different instances under D, but if you want me to change the mandatory language to permissive language, I can. If somebody's going to make that motion, I can make that change.
I'll make the motion that says they should.
To go to permissive rather than required? Mandatory.
So basically, shall to should, must to.
So he'll change all the,
Yeah.
the requireds to recommended, basically. For 4D.
Second.
Okay, you made that?
Yeah.
Motion by Mr. McCardle, second by Mr. Allen. Okay.
Any comments, Stephanie?
Just someone said that they were not able, that there's no thermometers in town, which I can tell you is not true.
I've heard
No,
that.
Actually, we
Oh.
bought 2 today, so, yep, Vera Home Medical did have the thermal scan one, so I do know there are some in town.
I just have a quick question. Like, my bartender opens the bar. He's the only one there. I'm not there to ask him them questions. So how do businesses that, one person opens the business, how do you enforce that? I'm going to FaceTime him and make sure he does it, or, I mean,
Just have him fill in the form.
okay.
Sign his name.
I mean, there's a lot of places that, one person opens it up. It'd be pretty tough for me to enforce him whether he took his temperature when I'm not there. So that's just kind of something to think about. How do you enforce that?
Okay, anything else, Stephanie?
And I just reported that that's me with my seasonal allergies, and I do have a mask on.
Okay, all those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. E. Anything in that? No?
I
F?
think,
Okay, 5. But can we look at this as each, like paragraph 5, all the items to get through? Otherwise, we're
But
going to be here
we haven't
forever.
done F yet, have we?
Yeah, we
For
just did
F?
F.
Oh,
Yeah,
Oh, you got a question?
I do.
All right. Back to
So it does say, I mean, I don't know if I'm reading this wrong, but it does say, even in phase 1 of the White House proposed reopening guidance, the recommendation is for schools and youth activities to remain closed, visits to senior living and hospitals to be prohibited, large venues and gyms to strictly follow physical distancing and sanitation protocols, and for bars to remain closed. So I'm wondering if we're not doing that, why we are including that language. And then it says, understand that any operation conducting business outside of these federal recommendations is anticipated to generate increased public complaints, which may then result in increased investigation by city staff into whether a violation has occurred. So I guess I want some clarification on that.
so,
Paragraph. Do you want to help me with that?
yeah, so what I'm getting at there, Susan, is what I would anticipate the scenario to be is you're going to have a bar that's opened up. Somebody might look at the federal recommendations and see that bars are still recommended to be closed at this phase, so they call in a complaint. That's going to result in our staff looking into whether there was a violation or not. We don't know what the outcome of that investigation would be, but we want to put those people on notice that there's going to be some increased scrutiny for their operations, not necessarily from the city intentionally, but because we're getting more complaints about it from the public. So that's the basis of that language, Susan.
So I guess I don't understand why that's necessary to add.
I think it's pointing out an exception of what their phase 1 is versus what we're implementing. And I don't know if it needs to be in, but it definitely is a deviation from what phase 1 is.
Right.
Yeah, we're not exactly what phase 1 of the president's.
If you look at the phases, we line up more closely with phase 1 than any other phase.
Right, but we're not saying that in this.
No.
That's an implied piece of information. It doesn't say at the beginning of this, we're following phase 1 of the federal guideline except for.
We're kind of
I just
following
think
phase
that
1
makes it
and 2.
confusing. I think that makes it a little bit confusing, and I'm not sure that it's necessary language.
We're kind of following phase 1 and 2. Phase 2 allows for bars to be open, phase 1 does not.
Right.
So we're following phase 1 and 2.
Kind of a hybrid.
But we were never closed the way the federal government was either. So.
I think what basically all this is trying to say is if you're following the guide or not following the guidelines, somebody reports you, we're going to investigate you.
That would be way simpler than what it is.
I mean, it's really more informative language than anything. It's, not putting a duty on anybody. It's just kind of saying, hey, this is kind of where we line up with the guidelines. Understand that if you're doing things that don't match up with them, it's probably going to result in some increased scrutiny.
I'm sure there's a reason the legalese are. Contracts are not always as simple as just saying, hey, you're going to buy this and I'm going to sell you this. So.
Any ideas of
Well,
what you'd want it,
I don't know, it just,
or how to change, or? I agree with you, but I don't understand
I mean, why can't we
the
just say
intent and
something?
why it's in
Yeah.
that section for
I
an
mean,
intent.
if it's easier for everybody, you can just take that section out. It's
Or
like
you
I said,
can
it's just
say,
informative.
those who don't abide by this ordinance will be,
I'd rather have it say
And
that they don't abide by this ordinance rather than refer to federal
right.
guidelines.
And really, the section was not intended to discuss compliance with our ordinance. It's discussing compliance with other standards that we're not specifically adopting. So if we're just talking about compliance with our ordinance, I would suggest just removing that subsection entirely.
Okay.
Motion to remove F.
Okay, I have a motion by
Second.
Mr. Arnold, second by Mrs. Sharp. Okay. Any comments from online?
Not that anyone has read their name into yet. Oh, here's one. We have one from, I'm sorry, I can't say her last name, Sonia Van Erdewick.
Van Ordwick?
Oh, very good, thank you. It just said the phases are guidelines, each city and state is different, there are not laws, big difference. This language does not seem to encourage complaining.
Doug, is there anybody outside there that wants to listen or to comment? I'm assuming he can hear.
Well, he can hear you in 15 seconds. Yeah. It's a delay.
Hey, nobody said this was gonna be easy.
Well, while we're
Oh,
waiting,
here we go.
you do have
Nobody, okay, all
Nobody.
right.
You do have 139 people watching on Facebook and 128 on YouTube, so.
Okay, we have a motion and a second. All those in favor of the motion to remove it, say aye.
Aye.
Whoa, opposed, nay? Who was that?
Aye.
That's normally where Mrs. Chark sits, remember?
Sorry, I read that wrong. It was supposed to be, the language does seem to encourage complaining. That doesn't.
Okay. All right, item 5. Now, I would like to recommend this. Let's go through all of item 5 and make the changes to this. And then vote on item 5 with the comments, okay? Rather than
Okay.
go each paragraph, or we're gonna be here till tomorrow.
Okay, so, I had a comment about this, actually, I got a call from Jeff Logan,
Which part are you talking about?
on 5A,
Okay,
and, where it talks about this shall not apply to immediate family members or members of the same household, and his, question was, so if you have two people that aren't related, but they come to the movie together, then they need to separate.
significant others.
So,
aren't
so
really
let's say
family.
that, friend, I don't know, he is the example of young Susan Charks and young Brian Charks go on a date, and do they have to sit apart from each other? Yeah,
Unless
right.
you're living together.
And he said, so then does that mean I'm in the business of checking out marriage certificates? I mean, how do I know, you know? And I respect that, I understand that. I think that the same is going to be applying when we're talking about bars and
Restaurants, yeah, of
Because
sitting at a table,
How
how
do
do they
you
know the
decide
family?
who is family and who's not family? I think that's a really ambiguous, that's really, I don't know, it's too specific language, I guess, is what my concern is.
You don't have to be married. Household, living in the same household wouldn't be married necessarily.
So basically, if
So you-
Danny and Marty went to the movie together,
You're gonna
they'd
sit
have
apart.
to- they'd have to sit 6 feet apart, wouldn't they?
That's right.
I'm not going to the movie with Mario.
Well, we're family.
I had it the same way, Susan, and the question I had was at a restaurant, so if 4 people walk in, I'm gonna have to ask them, you know, they wanna sit together, but you two are husband and wife, and you two are 2 brothers, and you came to eat here together, I'm sorry, you have to sit here, and you two have to sit at a table 6 feet apart. And then they'll sit there like me and Danny are apart and holler at each other across the restaurant. But I guess that's,
Is what it
to
is.
start, I'm interested to see how business is gonna try to adapt to that and how it works.
It's a slippery slope, and I am not sure that I know the perfect answer for this, but I don't know that defining it by family or household is the perfect situation, and I don't know.
I don't know how
exactly
you
what
do
is.
it, but
Right.
you could require everybody, I guess, to be 6 feet apart, but that's kind of ridiculous if you're living in the same house,
Right.
because you're together.
Or
I think that's the intent of this.
Or if you just keep it with the 9 and under, and they can determine who they would like to sit by.
So Jeff, when I spoke with him, I think he's out in the audience, I think, but I don't know if he wants to come in and,
Well, if you go to the movie theater, you'd be,
I hope you're not socializing when you're in the movie theater.
well, yeah, but you still, people sit next to
Jeff
each
will
other.
get you in trouble.
So let's say you got two people not married living in the same household,
That's in
How
the
you-
same household.
but how are you gonna know if they're in the same, I mean,
Well,
Or roommates at college,
Yeah.
college roommates, for example, they're living in the same place or.
not anymore, they're not.
They might still.
No, I get what you're saying.
yeah, and if you look at their driver's license, one guy's from Alec and the other person from Mount Vernon, but they live in Mitchell in a house together, I mean,
What do you want to change it to?
I don't know
So-
I don't know how you can determine who's who.
Jeff, what were you mentioning, like the 9 under, I mean, are you saying, so if there's a place they can have 30 people in their establishment, but they gotta have groups less than 10, and the groups that are less
Correct.
than 10 can be less than 6
Correct.
feet?
If it's 10 or more, it's not allowed. But if it's less than 10, is it 10 or less or less than 10?
Less than 10.
Okay, so 9 and under, and in all reality is you can determine if you want to be part of that group or not, and the business owner is not going to be the one selecting if you should or should not be with this group. Is you can self-proclaim your group, so it is a group of friends going out and having dinner together or whatever the case may be, and it just doesn't need to be just family, immediate family. So correct me if I'm wrong, this is really what Sioux Falls is doing.
Yeah, I don't think they're
I'm
down.
not
they're
sure.
not down to
I'm not sure what Sioux Falls is
Sioux
doing,
Falls
quite
was still
frankly.
9 or less.
Right.
But
But they also have social distancing required.
No, and I understand that, but there is no mention of family members.
Correct.
No, there isn't.
You want, Mr. Logan?
Thank
Or
you.
Whoever was first.
I think the practicality of this is exactly what I was talking with Susan about. A dating couple, they aren't married yet, come to the show. Now, I assume if they've been dating a while, they're going to kiss goodnight. Now, I have to tell them that they have to sit 6 feet apart. It makes no sense. The same token, a family, there's going to be probably more than 10 people in the auditorium. Now, before the shutdown, we had instituted social distancing. We roped off every other row. We asked people to leave 3 seats between them and the next group, which makes sense. I am not going to tell a family they have to split up. And no mother is going to let her children, if you have 3, 4 children, you're taking up more than a row. And you don't want your children sitting out there where you can't keep an eye on them. So the practicality, I mean, I think in a lot of these, the national CDC guidelines and the governor's guidelines were all good people trying to do the right thing with good intentions. The problem is when you get down to ground level, boots on the ground, and practicality, you can't think of every circumstance that will come up, and that's what some of the business owners are coming up with and what I'm faced with. I will have probably, and we will do everything we can. We'll space out show times. We're cutting down the number of shows in a day. We're leaving half hour to hour between movies so staff has time to clean. And we will ask people to social distance as we were doing for a few days before the national shutdown. But the practicality, we have to be able to let a group or 2 buddies come to the show together. Presumably, they drove in the same car together. It makes no common sense to say, you guys got to split up. Or am I going to check for marriage licenses if they're in the household? No one can do that. So I think in common sense and in real world application, we have to have some flexibility to say a group and define it as they came together, however, and then I'm not going to check, well, what car did you come in? Show me out in the parking lot. It gets ridiculous. So I think we have to use some common sense. We have to trust people. I don't want my staff to get sick. I don't want any of my customers to get sick from another customer or anyone else. So we're going to do everything we can. I think most of the public feels the same way. I'm careful when I go into a store, and we do what we can. So
In those couple of days that you had, did anything jump out that you didn't think about that you would put in place?
Not other than what I've said. Everyone, the nice thing was everyone was very cooperative. They kind of had the same fears all of us did. We met no resistance, and they were good about it and appreciative. And everyone kind of you know, it's like you kind of don't want to sit that close to someone, so they would almost space themselves out, but we asked them to. So that's, you know, and it'll probably be a few weeks before we're, even after we're allowed to, before we open the indoor theater. So,
Rapid City has it worded basically the same way we do, establish 6-foot minimum distance between tables, chairs, bar stools. Provision does not apply to members of the same household. Spearfish, in their ordinance, says you're gonna have distancing requirements. Must not allow 10 or more patrons at any table booth intended to accommodate on-site consumption or to congregate in groups of 10 or more. So they allow it by a group of 10, so.
I think if you do it by groups, it's practical, it's doable. Beyond that, to say household, they're ignoring unmarried people. They just hadn't thought of that possibility.
So when you've had your thing open, your movie, groups of 9 or more or less, or what have you had? What have you seen, Jeff? At your
Well, it was those last few days we were open. We'd have more than 10 in an auditorium, but not very many more.
Yeah, right.
But no, I mean, we never had a group of 10 come together.
Okay.
You know,
right.
we had groups of 2, 4. If it was a family, maybe 6. You know, if there's
Sure.
5 or 6. But and then they would sit together, and everyone would kind of sit far apart from them. And with a row in between, whether you're going sideways or front back, they had ample more than 6 feet, and it worked.
So will you be able to determine how many tickets you can sell per?
We set the cutoffs in the computer at less than half, but for an exact measurement, you're right. We may have to just, that gets to be kind of an usher and walkie-talkie back to the box office. Hey, we can't squeeze anyone in. Unless they're a single, I could put them in a seat over, you know, that kind of thing. It's a little, and some theaters have tried it with reserved seating, and they run into the same problem. A family will not be split up. And so then what do you do? And so, you know, they try to say, well, we'll put these or 2 seats together, we'll sell them as a block, and then over here, and we only have 2 couple seats, and we have 4 singles, and it's impractical. So
I think realistically, a lot of this, you know, people are gonna have to you're on the honor system as well. You know, we can't enforce every regulation, but if we get reports of it, then we will look into it.
And I just think if people understand that, once again, I'm going to say this again, that if we start seeing a rise in cases of COVID-19 after we've opened back up, the mayor has the
We'll shut it down
opportunity
again.
to shut it down again and go back to the way we have been. So I think, you know, I hope everyone understands that it's in everyone's best interest to use the protocol that we're suggesting.
And if, with the council's permission, we're considering, and this is the first time we've said it publicly, reopening the drive-in, which in the car allows perfect social distancing. We would limit, we've cut, again, the capacity in half, so you aren't parking 3 feet from the next car. You're probably going to be 12 feet from the next car if we do 1 car between all the speaker poles. Our only problem there is restrooms. We'll have to monitor as people line up 6 feet apart. And please don't go to the bathroom. It's emergency only, because we'll have to let one person.
Good luck with that.
Yeah, and what we found too is one family, other drive-ins have done, one family can go to the restroom together, because presumably they do in their household. And then we clean it between and then let the next person in. So it'll be limited capacity, but that's kind of what's been done seemingly safely. The snack bar we can handle, because we'll do it ordering online, and you pick up at a window, so it becomes like a takeout, kind of like we're doing the popcorn sales on the weekend now. It's takeout, just come in, and we text you when your order's ready, so there's no line waiting. So that's our plan, and we have a lot of, it's contingent on a lot of things, your action, and also we have a lot of technical and cleaning work to do out there, so bring it up to par.
Okay, thank you. Did you have?
Just a couple online comments quick. In general, on YouTube, people are saying you have to trust businesses to do what's right and to take care of their customers. We had another comment. I know this was stated earlier. Tim Goldhammer says that it would be good to, oh, whoops, that's the wrong one. Hold on. To use a square footage requirement. Can we rewrite this section allowing occupants based on square footage? That's it?
I
You know,
know-
go ahead.
I know, Rapid City talked about one person per 125 square feet. They had, not this 6 foot apart, they had.
They still have the 6-foot requirement in addition to the one person per
Okay.
125 square foot. Right below the one I just read, it says restaurants and bars, casinos should be limited to 10 customers. For smaller establishments, one customer for over 125 square feet for larger, whichever is greater, but you still have the distancing requirement.
Jeff, I'm gonna fall back to what you said before. I think, you know, instead of trying to monitor and, like you said, family households and stuff like that, I think if we get to the point, if I'm understanding what you were approaching on before as the group of 9 or less, not worried about the fact if they're family or from a household, things like that, because obviously if one chooses to go out and have, if it's at supper or at a bar or wherever it may be, obviously who you're choosing to sit with, more than likely you're choosing to sit with them because you have a good idea where they've been, what they've been doing, have they been following some protocols? Otherwise, I'm pretty sure you probably wouldn't interact with yourself with them, you know. I think people would make those decisions based on who some of those people are that they're hanging out with, you know. So I think it's really tough, like Jeff was saying, to try to monitor, oh, are you family, not family? Where'd you come from? What car did you drive into? I don't even want to think about getting to that. I just think the people, you know, like you said, once again, they're going to have to use the right choices out there, and the people that you're going to decide to socialize with are the ones that you trust.
Okay. Mr. Bates.
I thought I understood what the wording was after I emailed Justin, but some of the things you guys said kind of confused me a little bit. So are you saying that I can have a table of 9 people in one table, then I can have another table of 4 as long as they're 6 feet apart? Or are you saying?
We're working through that right now.
Oh, okay, that's what
We haven't said what it's going to be
right.
yet.
Well, that's what I was confused about, because it sounded like if I said, hey, Dan, I'll meet you at the depot for a burger, because we didn't ride together, we don't go together, we can't sit together. So that's kind of what it sounded like you said, so I was confused.
That's what we're working through is how it should be worded.
Oh, okay. And then I had another couple, while you're thinking about this. So I have 4 lottery machines sitting by each other.
Jason, and can you state your name? I have people wondering who's speaking.
Jason Bates. Sorry, big dummies. So I have 4 lottery machines sitting together. So if 4 people are playing it, that's not a group bigger than 10. So, you know, I heard some talk about every other machine. So we're talking about groups.
Right now, they would have to be 6 feet apart. Right now, unless they're in the same family or household.
Okay, and then my other question was, so if I have 11 chairs at my bar counter, you can't have each chair full. Yeah, but each person on each side is 30 feet away from each other. So how do you define
It'd be all right. You'd have distance.
How do you define a group of, you know, how big is the group? You know, that's
what we're
tricky.
working on right now.
Right, and that's why I just wanted to bring it up. You know, if I'm standing right in front of my customer, I'm roughly 5 feet away from them the way it is, not on purpose, just because I have a wide bar and I'm not a very good carpenter, so it just ended up that way. But, so I was just kind of, that's the questions that I think I was asking, and people up there were like, weren't understanding, so I thought I'd better come and point it out. Thank you.
The example of and I'm sure it applies to other casinos, the video lottery machines would have to be moved apart, and or you can't, and I don't know if they can, or every other one or every third one or whatever to make sure you had 6 feet.
Correct.
I don't know, are they movable?
Oh, I'm sure they're movable. Are they going to want to?
Well, that's simple enough. As long as you got the space, you can put them wherever you want. Yeah, or you can shut every other one down.
Sean Hone was up here last week, and he said if he had to move every other one, he would too.
Yeah.
When he was up here talking
every other one
last
off.
week.
Mm-hmm.
Okay.
I don't know about the square footage on you know, if you got a place like Blarney's a big place. I think as long as you're 6 feet apart, instead of having a square footage, and I think that's a better way to do it.
And that's really mandating
And they can take
in a roundabout way the square foot, because you're saying you can have groups of 9 or less, but each group has to be 6 foot away from each other.
Yeah.
So in a roundabout way, you've already determined how many people you can fit in a square foot area.
And I think that's a good way to do it.
I personally would just like to see 5A struck, because we're talking about 10 and under already, or under 10 already, and then not getting into the confusing of,
Family member?
are you a family member, are you under the same, you could be, like you said, brother or two brothers, they're family members, but not under the same household.
Jeff, unfortunately, it's not that simple. 5A is an exception. So if you just strike 5A, you're saying that every single person has to be at least 6 feet apart, no exceptions. So what you're really talking about is going way back up to section 2 and talking about the requirement of keeping a minimum at least of 6 feet separation between yourself and
Okay,
others.
so if 5A could be
Modified?
9 members of a party or less.
So not apply to groups of 9 under 10? That makes sense? Does that make sense?
I see where you're going.
Instead of saying family members, you say groups of 9 or less.
Yeah, groups of under 10, which would be 9 or less. Right?
Yeah, shall
Can
not
you tell
apply
us how other
to-
communities are handling that?
That's how they're pretty much handling.
Yeah.
Yeah, Rapid City says family members. Spearfish says groups of, what did I just read, 10 or less? You shall not allow 10 or more at any booth, table, or other accommodation on site.
Doesn't say family.
I'd
So
say
Spearfish allows
groups.
no more than 10 in a group. Rapid has it, but they also call out household/family member.
And
I'd be in favor of groups, because
Group of
how you gonna know who's a family member and who isn't?
Group of less than 10, okay.
Does that mean in the whole bar or in each?
No, each group.
Oh,
Each
okay.
group would be 6 feet apart.
Okay, yeah, 'cause I have 6,600 square feet, so I was just wondering
You
if.
get a lot of groups of 9 in there then.
Right, it could possibly, yeah, but that's why, when I talked to Dan, last week, we were talking about the square footage thing that they were doing, which makes more sense, because a place like the VFW is way, way smaller than mine, that's why if you went by square footage, but I'm fine with this, I'm fine with both either way, I was just clarifying.
I think the groups is easier to.
Okay. So for purpose of this ordinance, any requirement to maintain 6-foot separation should not apply to members of a group of under 10. Does that work for you? Okay. Paragraph B.
I'll make a motion on that.
We'll go
Not
through
yet.
all
Oh, yeah,
5.
oh, yeah.
Go through all
I
5.
forgot.
Otherwise, we're going to be here
I'm back to the old
a
way.
very long time.
Yeah.
Trying to get you out of here tonight. Okay, B.
I think B is pretty simple, other than we're going to say the other language that we had with the face covering. Remind me again. Instead of saying must, or that's what it does say.
Strongly suggest.
Strongly
Strongly
suggest.
suggest.
There you
Strongly
go.
suggest.
Yep.
Yep.
Did you get that, Justin?
Yeah, we've already acted on that one, so.
Okay, all right.
Yeah, that sort of changes,
All right.
I imagine, domino effect all the
So
way
B is
through.
okay?
Yes.
C? That just excludes healthcare facilities and whatnot, because obviously they're going to have to get close to each other to.
So does this allow for people to go into nursing homes? Or is that something that will be?
That's up to the nursing home.
Okay, because I know that in the
You
That-
can't get.
I don't,
White House one that,
I know to visit at Queen of Peace, they screen everybody that goes through right now. Well, they only allow one visitor per, they may
but
even
C is
stop
not,
that.
I didn't think you
No,
could get in.
see-
not applying to that.
No, not visitation. This, what we're doing is excluding this from healthcare, the proximity to healthcare, nursing homes, those places that care for people, where you
So-
have to go up and take
So-
care of them physically, correct, Justin?
All the ones that are listed in C aren't subject to any part of the ordinance.
Right. Okay.
They're
That-
recommended to follow those practices, but they're not required to by the ordinance.
Mayor,
Yes.
so we had a question online for back to A. where you changed it to say groups. What if the family is a bigger group than 9? Okay,
Probably go to
Split
2
up.
tables.
okay.
2 tables, 6 foot away.
Yeah, it's,
They don't have
And
many
I-
of
and I-
those anymore, but there are a few, I would imagine, so.
yeah.
Okay,
I understand I understand their concern, but we're trying to do our best to do what we can to open things up a little bit, and we start getting to situations like that, I mean, we might as well just not have any kind of rules and just go back to we're all open and have the mayor lift the ordinance, but, and like I said, apologize if ones that got bigger than 9 family members, but at some point in time, we gotta have some kind of restrictions, otherwise we're not gonna go anywhere, so.
Thank you.
no. Okay, so the
Oh,
only
Mrs.
change,
Oh, sorry.
I'm sorry, go ahead.
Okay, no.
The only change to item 5 is groups of under 10 in A.
Right.
Okay, is there a motion about
I'll make my motion now.
Motion by Mr. McCardle,
Second.
second by Mr. Rice. He just beat you, Mrs. Charles. Okay, further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. 6, penalties and nuisance treatment. In essence, that's just setting out in our current ordinance what penalties can be.
And
then
that,
it could
that
go-
matches our current wording?
The only difference, correct me if I'm wrong, Mr. Johnson, the only difference is that we allows us to go as a nuisance property if it continues. Go ahead.
So A is the same, C is the same, B is new. And that just allows us to, in addition to everything before, we can also treat it as a nuisance and potentially take care of something immediately.
There's no fee or fine assessed?
Our ordinance.
General penalty is a fine of up to $500 and up to 30 days in jail. That's for every violation of a city ordinance.
And if we had to go to nuisance, we could recoup some of the cost for the nuisance, correct?
Correct. So if we treat it as a nuisance and there were some expenses to abate that nuisance, say, for example, you had to secure a facility, you could attribute those costs to the property owner and they'd be responsible for those costs.
And can you give like an example of what was discussed about where the nuisance would help you from an enforcement standpoint or an investigation standpoint?
I would envision if somebody continues to violate things, you could go in and move some tables out, treat it as a nuisance and take tables out of it.
Right. So, yeah, say that you had a facility that was, packing itself with people, wasn't in compliance with the distancing requirements and all that, you could go in and shut that business down. And you could secure it, and then they could reopen once they're compliant again.
Hopefully we don't come to that, but okay. Paragraph 7 is just that it remains in until it's repealed. Any issues with that?
I wondered about the ordinance one time, if I don't know,
What?
if we revert, then I guess so I guess I have to go to 8 before I can address 7. Is that okay? So,
Okay.
So on number 8, number 8, we talk about that the mayor has the ability to exercise the executive order, and that you can declare an emergency and shut everything down again, right? So my first question to that was, what will be the breaking point? Do you have any guideline of what that would look like?
If
Do you have
we
a
start-
number in mind?
I have no number in mind. It's one of those things, we got to see what happens. Currently, we held at 3 for almost a month, and then we went up 2. That was a concern. Obviously, one of those is recovered, and we're still at 1. The area around us, as we watch that, is not increasing any yet. So,
And Susan, I'll make the same comment as I did at the last meeting. The social distancing will not stop the spread. It will only slow down, and it was never intended to stop or prevent the spread. And get irked when I see headlines and I see banners and everything else. Please social distance to help prevent the spread of COVID-19. It was never intended to prevent the spread. It was intended to slow it down. So we
So is it
will
your-
have,
Like, do you believe
we will have more cases.
if we did, yeah, oh, of course we will. Yeah, I know. But do you believe that if we did nothing, that we would, everything would, if we did absolutely nothing, if there were no conditions, you still, so do you think that
You mean if
everything
there
we're
was no
doing
ordinance?
here is
No.
moot?
No, there would still be cases. There'd probably be more cases, but it's not going to stop or prevent the spread. There's no way to get that. Like the woman came back and said, if there is no vaccine and no other way to test and segregate, we're going to run through this again in October, November, and December, and it might be worse.
It might go away.
It might go away, but that going away hasn't happened in medical history. So, I mean, the comment of HIV is 40 years old with there's no vaccine. We still have it. And people still die from it every year. And people still get it every year. And there's no way to stop it. But you can slow it down.
I think that what this is going to do, as Steve said, over a 12-month period, you're going to see a certain number of cases. So is that going to be spread out evenly over 12 months, or is it going to be a spike? And in all reality, and Bob and everybody else at the city is constant contact with our hospital. It really gets to a point of, at what point do we overwhelm the hospital? That ultimately, I think, is where the decision is made that we cannot care for the current citizens or surrounding area that is going to have to be hospitalized. To me, that's really what's going to drive if we have to revert back.
Yeah, and I agree with that, Jeff. But I would hate to wait until the system's already overwhelmed. So.
And I agree, Susan, and part of my concern, and it goes back to the discussion that John brought up on the timing of this, we can go back based on the mayor saying that, but the timing of first and second readings and all of that type of stuff really handcuffs us.
We know we flattened the curve. Have we flattened it enough? That we don't know. But everybody from Queen of Peace to Avera's system to Sanford and the health department all agree we've flattened the curve. I know no magic number. I'm just going to continue to watch them and listen to what the other mayors say, and we'll work from there. I mean, this is unprecedented territory.
Okay, so I'm going to use a hypothetical then. Let's pretend that we get to the point where you're saying, I'm concerned, and I think we need to revert back, okay? So hypothetically speaking, that happens. Now, in 7, it says, this ordinance shall remain in effect until amended or repealed by the city council, except that the mayor may order the temporary suspension of the provisions of this ordinance one time.
Correct.
Okay, so
in other words, if I see things becoming alarming, I can say, hey, we're shutting down. I have to bring you, I can't?
No, we're doing this backwards.
You can lift the ordinance, but you can't put a new one in place.
Right. I'm not putting a new one in place.
Right, but you can't shut the city down.
This will explain to me.
Yeah, so
First of all, I would ask him for his legal advice.
Right, but I don't think, from my understanding, well, Justin will say it, but I don't think you can shut them down. You can just lift this ordinance.
Yeah, so 7 is talking about repealing this ordinance. So that means if Bob gets to a point where he believes that we don't need to have these conditions in place anymore, the ones we're talking about tonight, about requiring people to follow majority of the CDC hygiene guidelines.
So in that instance, everything's improved.
Right. So if things have improved and Bob thinks the ordinance is no longer necessary, he can temporarily suspend it, bring it back to council, and the ordinance goes through the repeal process.
Right.
If we're talking about Section 8, that preserves the mayor's ability to implement additional restrictions. He's not limited to do that a single time. Now,
That makes
it's still recommended that he come back and bring an ordinance through,
That's
to
where I-
implement additional restrictions, but our existing ordinance gives him the authority to do that.
So if I see it getting bad, I could implement emergency again. Of course, we would come back and have that discussion in a council meeting after I do that. Okay? That's where I was going with this, all right?
Because you would only have to lift it once if things are better. Is that the point?
I would hope
Yeah,
so. yeah.
hopefully.
Unless we get
Unless
to
it
next
gets
November or October or something else comes up.
I don't know what the future holds, but yeah, let's,
One week at a time is optimistic, one day at a time is even questionable.
I do have a question from
Okay.
council from JP that came on YouTube. JP asked,
JP Kelly.
yep, sorry, JP Skelly. Just curious how many council members were screened before tonight's meeting.
I know 2 of us were. I don't know if anybody else screened. So 3 of us were.
I read the email.
40%.
All right. So now, correct me if I'm wrong, Mr. Johnson, we need to have a motion to approve the overall thing as amended, correct?
Yeah, place it on first reading,
Exactly.
reflecting the changes. Now, one thing that I will harken back to is that we don't know what's going to be in Governor Noem's executive order and guidance tomorrow. So I would put a caveat in here that if there's something in there that requires us to come back and make additional changes, like if she's completely changing her guidance and saying that South Dakotans should no longer be following the CDC guidelines, we'll need to come back and make additional changes to this. So I think the expectation can be that we'd have a second reading of this with the changes next Monday night. But if, based on the things that come out tomorrow from the governor's office, if we need to come back and have an additional first reading with changes that come out of that, guidance from the governor, then we can do that maybe sometime later this week in another special meeting so that we're still on track to keep things getting changed sooner rather than later.
So at this time, Justin, and not that I need you to, I know where we're at, but do you need to recap what we've all discussed on our changes for, the public, those that are listening, just sort of a recap so we can make a motion for the overall change of this ordinance?
Yeah,
And then I don't know, is there anybody else out there, Doug, that'd like to speak on behalf of anything else besides our issues that we talked about?
So I can just give the recap while we're waiting for people to come in, if there are any. Relating to Section 2G and cloth face covers, we're removing the requirement and changing it to strongly suggest. Under 4A, we're changing ensure to encourage. Under 4D, we're changing the mandatory language to permissive language. Under 4F, we're removing that subsection. Under 5A, we're changing immediate family members or members of the same household instead to groups of less than 10.
And can you explain that a little bit? Because I had a person that, so will you explain how that's going to be read, how that will read basically?
The exception? Okay, so under 5A, the new version would read, for purposes of this ordinance, any requirement to maintain 6 feet separation shall not apply to groups of less than 10. And it looks like that is all the changes. And we've already acted on each of those individually, so we'd just be looking for a motion to place on first reading with the previously approved changes.
Did I miss it, or did we talk about it, or is it not about how many people can be in a business? This is not part of this, or it doesn't have to be?
What's that? Right
Yeah,
now,
we talked about it.
Groups.
right now it's open. Yeah.
You
go
just
ahead.
have to maintain 6 feet. So how many you can fit in under those guidelines.
And maintain your distancing.
In groups up to 9.
So there's no number.
Well, it's gonna be self-defining.
Understand that you're opening a can of worms there, in my opinion, but,
Move to place on first reading.
Second.
Okay, we have a motion by Mr. Allen, second by Mr. McCardle. Further discussion. Okay, anybody, there's nobody, Stephanie, anybody want
It doesn't look like it, no, it's just
Okay.
comments.
to, and nobody out? Mr. Bates,
It
you got
doesn't
anything else
look
you want
like
to say?
There's some random comments.
Started touching the doorknob. I just had a question. So if I have 4 lottery machines together, that's only a group of 4. So you're saying that's not okay?
You gotta have 6 feet between them.
Okay,
Unless
even though
they're
it's not
all
a,
4 together.
okay, so even though it's not a group bigger than 9.
And the reason for that, Jason, is you can't assure that the 4 that are sitting there are together as a group.
Right, but that goes back to my other question about my bar counter. I have 12 or whatever, but the 2 people on the ends are far enough apart, so I could have 12 that's bigger than 9, but they're far enough apart. That's where it gets tricky. So, and then I have 2 lottery machines in that group of 4 that are more than 6 feet apart. So how do, you know what I'm saying? It's getting really hard to determine exactly what you're saying, so that's why
I'd say make sure you have your lottery machine 6 feet from anything.
right, but I have 4 together, and if you take a measurement from one lottery to the first one to the 4th one, that's 6 feet. So
2 in the middle, I'd spread out 6 feet again too then. Make them all.
each machine has to be
Be
6
6
feet.
feet apart,
Okay,
yeah.
that's where I didn't understand what you're saying. I got you.
And you
And,
can't guarantee that the 4 that come in and play, those machines came together.
right, I just didn't understand exactly how you were saying that. So, okay, so if I had 9 separate people come in and sit at the bar, none of them came in together, but because the people on each end are more than, they're 30 feet apart, is that okay or is that not okay? That's what I'm trying to understand.
If they're not part of the same group, they each need to be at least 6 feet apart.
Oh, okay.
Okay?
I do have one other question. Pat Dockendorf wants to know how this new ordinance affects baseball or the Dakota Bulldogs amateur football team. That's a group
Well,
of 10 or
that's
more,
a
not
group
from,
of, over 10, so they would have to be 6 feet apart. So I guess if you got 9 guys playing the field and not coming together, but
Right, but
I don't
how do you
see
have
that
how do you have an umpire and a batter and a catcher?
yeah, you're not, you can't keep the 6-foot separation and have those things happening.
I don't think
I'm-
there's baseball and football going on anyway.
Well, not yet,
But
but you
they-
don't know.
It's not till June.
American
they-
Legion,
Yeah.
it'll be, I don't know how many American
I guess
Legion
I would
plans.
think about that, the question of being able to practice
They could theoretically do that and keep people 6
if they
foot
keep
apart.
6 feet. But a game, and I've talked about this in our family of, because there's some baseball players, but how does a catcher, umpire, and batter maintain 6-foot distance?
You can't, Major League Baseball
and have a
can't
game?
do
They
that.
can't. You can't do that based on the way this is written right now. So there couldn't be a game, but that doesn't mean, I guess, you could have a practice.
Yeah, and I've had some people call about practicing, obviously, I know Nathan's back there too, but with Catawba being closed, stuff like that, but I've had people, now they've been saying, can we practice, as long as we're spread out, to throw the ball back and forth and things like that, and so, well, we'll be looking into what we're doing now, so I know that is definitely an answer that people are gonna want, and I don't know if it's from this ordinance that we're doing here, obviously, to give direction to Nathan and the Park and Rec.
It gives Park and Rec an option to talk about how some things might be able to operate with groups and that
Yeah,
type of
currently,
stuff.
the president's task force or whatever recommends no youth activities through, July, or up to June or, there's a time frame in there.
Okay, 'cause
And really, the time frame pretty much squelches most of youth activities here in Mitchell,
And
as
the
far
other
as
thing, obviously,
baseball,
with-
softball, and those things go. Did you want to say something, Mr. Powell?
you know, the other thing too is, you know, our swimming pool. You know,
I was just gonna reiterate that there's still no youth programs recommended at this time, so
Right.
that's what we're looking at. Swimming though, you know, that one's up in the air because it doesn't,
You
you know,
got
there's
chlorine
no
in the
problem with
pool.
the virus with the chlorine for the most part. The only thing you gotta watch is hand railings or things like that.
In
that can wipe
bathrooms.
down.
In
Right,
changing rooms
bathrooms,
and lockers.
locker rooms.
You could keep some of those closed and, you know, they could just come ready to go, but, we'll be having to talk about that as we go along.
Right. We're a ways from that yet. And quite frankly, we're kind of putting a few more restrictive measures on city facilities than we are on general public, so.
Mayor, have you thought at all about the Corn Palace?
Every day, yeah. I'm not sure how we're gonna do that. Right now, it remains closed as well as JVCC and the library. Okay.
While you're talking about activities, I have a question I'm sure the vending company would like to know. Summer dart leagues, each team, there's teams of 2 and teams of 4. So I mean, you're not groups bigger than 9, and all my tables are more than 6 feet apart anyway. So,
But you have to have the 6-foot spacing except for the 4 that come together, I would guess. I guess they're a group. I don't.
that's what I'm asking,
Yeah.
because all my tables, because of my dartboards, are more than 6 feet anyway. So, and Britt Brewer, messaged me today and said he's gonna stop and talk to me tomorrow. So, you know, our summer dart league's okay. They're small groups.
As long as you meet the spacing requirement, yeah, I don't see why you wouldn't be.
Okay, yeah, because Tuesday nights is 4-man teams, so you only got 4 people at each table, and then the other nights are 2-man teams. So you have small groups.
Oh, and believe me, if you're violating that, people will let us know. We get all kinds of people
I'm
that
sure.
call us with these things.
I'm sure, and I hope that we can get done with this, and I don't have to see you guys for a while.
That'd be nice.
I feel like we're dating.
If we could
Believe-
just have people that come up to the podium to please state their name, I get questions right away when we don't do that. That was Jason Bates.
They don't know me by now.
They're not used to seeing you like we are, Jason. Believe me, I wish I got paid on the conference call. I could retire about this year. Okay. All right, we have a motion and a second. Any other discussion? On first reading.
One final comment with, Justin, will this need to have a second first reading? Are the changes substantial, or is the intention still to have the second reading on Monday, and we'll try to get it published Wednesday's paper?
We could still proceed with the second reading even though the changes are
Okay.
substantial.
Okay.
If you make substantial changes at a second reading, you have
Okay.
to come back for another second reading.
So then we will attempt to get a hold of the paper and see if we can have it ready for publication Wednesday. That's another question that keeps coming up online, but that deadline for the paper is this Friday anyway, so
Correct.
whether we meet on Monday or Saturday isn't changing that.
No, okay. All right, all those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried.